Live on your health tonight, the race right now to control the Ebola outbreak. New data from the Congo and Uganda shows a sharp increase overnight in the number of cases. Health officials now report more than 130 deaths so far and at least 500 infections.
Joining us now is Dr. Shenoy, the Chief of Infection Control at Mass General Brigham. Dr. Shenoy, thanks for your time. Good to see you again.
Good to see you.
All right, so the head of the World Health Organization said today that he is worried about the, quote, speed and scale of this outbreak. Do you think that is the biggest challenge right now?
I think it certainly is. The reality is that early in an outbreak like this, especially where it's out of the gate with hundreds of cases reported, we're going to expect to see that the cases are going to rise, and it could be pretty quickly. I think there's two things that are really important to keep in mind. One is that we're in a catch-up period. So we're just learning about this outbreak over the last 5 days, but it's likely been circulating for much longer. So as we start testing, as we start responding, we're going to be identifying many cases. The second piece is we don't have a vaccine to be able to deploy. And so in other outbreaks where we've been able to quickly respond with vaccines and do a ring vaccination strategy, we've been able to use that tool to stem the outbreak.
So the CDC says that the overall risk for Americans is still low. Do you still agree with that?
Absolutely. The risk in the U.S. is low. There's new travel guidance that people are probably aware of from the State Department as well as from the CDC. I think it's a good reminder overall, if you are traveling and this is the travel season, it is a very good idea to check in with the CDC, where you're going by country, and they'll list the sorts of risks that are there and also a lot of things that you can do to prevent health risks when you're traveling.
So what are you folks at MGB doing right now about this?
Yeah, so we're absolutely monitoring, as I think most healthcare facilities are. Actually, starting over the weekend, we are involved in some meetings with our federal partners, with public health, trying to really lean forward. We've been planning for a long time. Most healthcare facilities do. MGH is the Regional Emerging Special Pathogens Treatment Center. We're one of 13 facilities around the country. We maintain a biocontainment unit, and we do a lot of education in the region to make sure that we're prepared for whatever may come across our doorstep. So we're absolutely leaning in on this and making sure that we're all ready to respond as needed.
All right. Dr. Shenoy, thank you.